We continue now with the second part of our formalities. Please welcome to the stage once again your host, media personality, Makeda Mahadio.
Thank you. We trust you enjoyed your comfort break and hopefully you're feeling ready to go for the rest of the program. With the incredible support and commitments made over the years so far, 46 countries have eliminated at least one NTD, with Rwanda eliminating human African trypanosomiasis, commonly known as sleeping sickness, earlier this year. Well done. It's wonderful to know that a staggering 600 million people no longer require treatment for NTDs, and cases of some diseases that have plagued humanity for centuries, such as sleeping sickness and guinea worm disease, are now at an all-time low, and much of that is thanks to you. It is therefore vitally important to continue remaining 100% committed in our pursuit of ending the dreadful cycle of neglected tropical diseases. They are preventable and they are treatable.
In the last 10 years, Susan was able to see again. Sar was healthy enough to go back to work. And Nishu got one step closer to fulfilling his dreams. Because countries, companies, and partners have united in the fight against 20 devastating and preventable diseases that impact the world's most vulnerable and under-resourced communities. Over the years, we've witnessed the incredible things we can accomplish when we work together. We all shared ideas, invested in treatments, improved supply chains, and delivered life-saving drugs to even the most hard-to-reach communities. More than 14 billion treatments have been donated. More than 45 countries have eliminated at least one neglected tropical disease. Hundreds of millions of lives have been positively impacted around the world. With national governments leading the way, we have a chance to control, eliminate, and eradicate neglected tropical diseases in 100 countries, to collectively reach a historic win for humankind. To take one giant step closer to having a world where her family, their community, his patients, her shipments, their business, her dreams, and the risk of neglected tropical diseases are neglected no more.
Neglected tropical diseases are a group of 20 diseases that affect over 1.7 billion people worldwide, often those living in extreme poverty. They include diseases such as trachoma, leprosy, intestinal worms, scabies, and elephantiasis. NTDs prevent children from going to school and adults from going to work. They impair cognitive and physical development and cost the economies of endemic countries billions of dollars a year. Efforts to tackle NTDs are a global health success story. 46 countries have eliminated at least one NTD. 600 million people no longer require treatment for NTDs, and cases of some diseases that have plagued humanity for centuries, such as sleeping sickness and guinea worm disease, are at an all-time low. This proves that ending NTDs is possible, but there is still a lot more work to be done. Today, we will translate awareness into action and secure increased resources for NTDs. By working together across sectors and adopting people-centered approaches, we can end NTDs and achieve the targets in the Sustainable Development Goals and the WHO 2030 NTD Roadmap. These goals include eradication of 2 diseases and 100 countries, eliminating an NTD by 2030. It is this target of eliminating at least 1 NTD in 100 countries that has inspired the 100% Committed movement. The 100% Committed movement exists to connect and amplify our voices, especially those of affected people. Together, we call on our leaders to show they are 100% committed to ending NTDs. I am 100% committed. Join me in winning the fight against NTDs.
Let your action show. Don't you hold it up, just be the words you say. There are people dying while you hesitate.
If only one is hurting, we are all in pain. If we stand together, we never fall again.
We can give someone a chance to live a better life, to see through better eyes. Join the fight, so light a fire, take the spark around the world. Let the human spirit burn, that our voices will be heard. And we're not leaving anyone behind. Together we are strong, in a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? Let your action show.
Like kind light in a dark corner, like floodlights crashing through the gate. Our voices ring loud, our spirits burn bright. With our action now, we determine how long this fight will last.
So let's walk the talk, till our feet leave landmarks in the sand, till our pledges become rhymes, kids will sing with a smile in the memorial of victory. We are 100% committed, we are honoring our pledges, so be 100% committed to ending the negative tropical diseases. So are you with us? Because
we're not leaving anyone behind. Together we are strong, in a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? And we're not leaving anyone behind. Together we are strong, in a better world is where we belong. Join in the fight, be the voice of hope. How do we make things right? Let your action show.
Être 100% engagé à l'élimination des maladies tropicales négligées.
mwetendeteka okuba nga mutolawo obulwadde bw'omusolo
অবহেলিত গ্রীষ্মমণ্ডলীয় রোগসমূহের অবসান ঘটাতে আমাদের শতভাগ প্রতিশ্রুতিবদ্ধ হতে হবে
मिलकर नजरअंदाज शुदा ट्रॉपिकल डिजीजेस को खत्म करने के लिए 100% berespon.
Komitmen 100% untuk mengakhiri penyakit tropis yang terabaikan.
Make we run maximum effort for the bege against Yamayama disease.
Be 100% committed to ending neglected tropical diseases.
Another round of applause for our singers, please, distinguished guests. That emotive song was written and composed by Manasseh Mashi, Uzoma Ibekwe, and Alamin Al-Hassan, featuring vocalists from around the world, including winners of the NTD Youth Storytellers Competition, standing united together as one, 100% committed. It was originally produced as an online music video at a time when we were unable to host in-person events. We are therefore so proud to have presented the first ever live performance of this song featuring local Rwandan artists sharing the stage with the original vocalists. A truly international collaboration. We continue now with a discussion highlighting the need and opportunities for developing and delivering new tools and technologies in the fight against malaria and NTDs. To introduce this panel, please welcome Youth Combating NTDs Board Chair and Deputy Director of the Rwanda Biomedical Center, Noella Bigirimana.
Thank you. Hopefully you can hear me. Thank you so much. So I'm wearing two hats today, one from the perspective of the host country, Rwanda, but another one, as we just heard, as the board chair of the Youth Combating NTDs. I hope to catalyze what we heard today about the impatience of the youth. So the session, as we heard, is about innovation and new tools, and the panel in particular that we're about to start is around setting the stage, what is in place, what are the existing pipelines, and future opportunities. We'll be able to hear from speakers that will give us that perspective. Help me welcome the speakers for this panel on the innovation agenda. We'll start with the director of the malaria program within the Bill and Melinda Gates Foundation, Dr. Philip Welkoff. Welcome, Dr. Philip. Next, we have the Executive Director of Drugs for Neglected Disease Initiative, DNDI, and that's Dr. Bernard Pekul. Welcome, Doctor. We also have the Director of Preventive Services within the Ministry of Health of the Republic of Tanzania, Dr. Beatrice Mutayoba. Welcome, Doctor. Last but not least, the Undersecretary of Health Strategies within the Ministry of Health in Argentina, Dr. Juan Manuel Castelli. Welcome. So, as we know, it's the Kigali Summit. We know that there was a declaration earlier this year, but it's not just on paper. We're about to talk about it from the perspective of a commitment. It's really, truly about a commitment. So if you allow me to start with Dr. Philip Welkoff, from your perspective, from the Bill and Melinda Gates Foundation, if you can share with us just kind of an overview, because we'll talk about not only new tools in terms of developing them, and then later we talk about access. So tell us a little bit about these new tools, what's in the pipeline, what are your focuses?
Well, thank you very much. Global efforts, strategic investment, and country leadership led to the development and rollout of a new set of tools to fight malaria that drove remarkable progress over the last 20 years. The artemisinin combination therapies, long-lasting insecticide-treated nets, sprays, rapid diagnostic tests, together now save over 500,000 lives every single year. But progress is threatened by resistance, and we still see over 600,000 people dying every single year due to this preventable and treatable disease. So in addition to doing more with our current tools, We have to continue to drive innovation forward for a number of reasons. First of all, we need to get ahead and stay ahead of resistance. Given numbers, time, and selection pressure, evolution is going to win. And the fight against malaria gives us nothing but numbers, time, and pressure. So we see drug resistance threatening the ACTs. We see insecticide resistance threatening our nets and sprays. And we even see HRP2 deletions threatening our lateral flow assays. So as long as we're fighting malaria, a steady innovation and urgent innovation to keep our current categories of tools working is going to be essential. And then we also know that we will need additional tools to actually eradicate this disease. It's not enough to just keep our current tools working and scale them up. And COVID-19 and the disruptions and the upsurge in malaria burden shows how brutal and unforgiving this disease really is, and why we have to continue to push all the way forward to a world free of malaria. So how are we doing on this? Well, I'm delighted to be able to say that the R&D pipeline for new tools against malaria is in the best shape that it's ever been. This is due to the tremendous work of partners around the world, researchers, scientists, companies, funders, all working together. In terms of fighting resistance, the newest artemisinin combination therapy, Piramax, is proving to be highly effective and is working to treat even the most resistant strains in Southeast Asia. The first non-artemisinin-based combination therapy, ganaplacide lumefantrin, just had a very successful 2B trial and will be going into phase 3 later this year. We have new tools to keep our diagnostics working in the face of the HRP2 deletions. And then the first new insecticide for public health in decades, chlorfenapyr, just had its results come out from being incorporated into the Interceptor G2 net. And tests in Tanzania showed absolutely remarkable benefit in terms of what can be done in the face of the pyrethroid resistance that is threatening so much of the progress. So there's a lot of work happening there. But in addition to keeping new tools working, there's some new tools in the pipeline that could actually help us drive down burden even more aggressively and effectively. Attracting targeted sugar baits showed initial progress and promise in trials in Mali, and they're now in their final phase 3 trials in Mali, Zambia, and Kenya. This could be a transformative tool in terms of increasing our vector control tools available, and it could become available as early as 2024. We're also seeing real promise for monoclonal antibodies in phase 1 trials in Mali, and now this year in phase 2 in Mali, and soon to be Kenya as well. This could absolutely change and make it much easier to provide the seasonal protection to vulnerable populations, including the youngest children. In addition to these tools, there's actually some really exciting things in the portfolio that could transform the fight entirely and help us get all the way to eradication. The fight against COVID drove forward new vaccine technology, whether it's mRNA vaccines or new adjuvants for vaccines. And these advances are now being pivoted to develop potential second-generation vaccines for malaria that would be higher efficacy and longer duration. Very exciting times for that. And then while it's early, genetically based vector control has shown real promise in early lab experiments. Wanted to say that it's not just innovation required for the new tools in themselves. There's real innovation possible in our systems. And we see both with genetic sequencing of the parasites and vectors, campaign digitization, that innovation applied to the delivery as well can be incredibly powerful. So there's a very exciting pipeline, but of course this is going to need to be met with work on the rollout, work on health systems, work on financing, and of course, and all of this driven by country leadership. So very excited for this moment.
I want to thank Dr. Philip. So as you just reminded us, not only are these diseases preventable and treatable, and you just took us through the new tools, and you're telling us about the delivery as well. This is exciting. I'm sure we'll be reading it in the news in the coming years. I want to turn my attention now to Dr. Bernard Picol from her perspective, from the DNDi perspective. Can you tell us a little bit from your perspective on these new tools and innovation that you're having in terms of delivery in fighting neglected tropical diseases at your institution?
Thank you, Madam Chair. It is a great honor to be speaking here today, and I would like to thank the government of Rwanda for this excellent meeting. I was in London for the declaration we made together in 2012 to control, eliminate, or eradicate 10 diseases by 2020. 10 years later, it is great to see the energy and renewed commitment of all actors to meeting the ambition of the new WHO roadmap on entities. One of the most critical aspects for our success in meeting the goal of the WHO will be medical innovation. Together, in the last 20 years, product development partnership, including my own organization, Drug for Neglected Diseases Initiative, but also Medicine for Malaria Venture, FIND, IVCC, successfully deliver more than 65 health tools. These vaccines, medicines, tests, and vector control tools bring urgently needed solutions against diseases, including malaria and NTDs. Together, we have reached more than 2.4 billion people, including the most vulnerable women and children. This is an alternative, non-for-profit research and development model that works. DNDi itself has delivered 12 treatments for its first 20 years. Our ambition is to bring 25 new treatments by 2028, which is DNDi's commitment to the Kigali Declaration. Let me take an example. When we began, the only available treatment for sleeping sickness was based on arsenic. It was so toxic that it killed 1 in every 20 of the patients we treated. Patients were afraid to come for treatment, and as a doctor, I was afraid to give this medicine to people. Today, 20 years later, thanks to medical innovation, we have a treatment that removes the need for hospitalization, and instead of infusion of arsenic, we have a simple pill for 10 days. The result is truly a revolution, because we now have a safe and effective treatment, and one that is possible to use at the primary healthcare level. It raises the hope for a disease-free generation, unlocking the potential for elimination of the disease once and for all. This was possible thanks to our partnership with the researchers, the Ministry of Health and Hospital in Democratic Republic of Congo, the WHO, Sanofi, and our partners in Angola, Congo, Central African Republic, Chad, Guinea, Sudan, South Sudan, and Uganda, who play a leading role in our work. We need to replicate this success. We still lack tools for prevention, diagnosis, and treatment that are simple, safe, and effective, and then can be easily integrated into already overburdened health system. For most entities, inadequate investment in medical research threatens progress towards sustainable disease elimination. If one thing is clear from my 40 years experience on the front line of neglected tropical disease patients, is that the key ingredient of our success is partnership. Our success is our partner's success. Many of you have joined us in bringing the best science for the most neglected. I would like to recognize here the commitment of many of you that are today in this room or online. Like other product development partnerships, we are able to innovate because our projects are collaborative. We provide a bridge and bring together the unique experience and role of academic research, pharmaceutical company, and public sector. As we discuss what is needed to reach the target of the WHO roadmap, my call to our partner will be, to the public sector, we need political leadership to support local and regional innovation networks, and to ensure access to new tools that need to be integrated into an essential package of care as part of the commitment of universal health coverage. To our partners in industry, we call on you to join forces with product development partnership and make innovation possible. However valuable this effort has been, the contribution of the pharmaceutical industry cannot be limited to giving donation of already existing treatment. We need you to engage in innovation and sustainable procurement. With sustainable funding and closer relationship with private and public sector, we can replicate these successes. So that a child with visceral leishmaniasis here in Eastern Africa, a farmer with filariasis in India, or a teacher with Chagas disease in Africa, all have easy access to prevention, testing, and treatment tools meeting their needs. Only when this becomes a reality, we will know that we have delivered on the promises we have all made today to the most neglected patients around the world. Thank you.
I want to thank Dr. Bernard, and I don't want us to miss the commitment that you made. You said 25 new treatments by 2030.
2028, which will support implementation until 2030.
Even earlier. So I want us to be able to document this because as he mentioned, it's about renewed commitment. And so we have now an opportunity, and thank you again, Dr. Bernard, we now have an opportunity to turn to Tanzania. We just heard from two speakers what is being done in terms of new tools that are being developed in terms of prevention, diagnosis, treatment. Let's turn a little bit even more on the delivery. Could you highlight for us some of the innovation, delivery successes that you've had in your country?
Thank you, Madam Chair. Ladies and gentlemen, good afternoon. In Tanzania, in our country, new innovations is a subject that is very dear to our hearts as a country, where we clearly acknowledge that in this era, you cannot drive any type of significant change without it. We've done quite a number of innovations, especially in the service delivery area, but today I'm going to stick or to highlight a few examples on the malaria aspect, and not because I'm neglecting tropical diseases. So by 2017, Tanzania had made a remarkable achievement of having the burden of malaria from a prevalence of 14% to 7%. Of course, this is tremendous progress. Like they say, the last mile is always the most difficult. So together with our partners, we started thinking on how we can fast-track progress even further, but in an efficient and effective way. In 2018, Tanzania was among the first countries to embrace an innovation known as malaria stratification approach, where the country was divided into small subunits known as epidemiological stratas. We have stratified the country beyond the council level, where all subunits in the country are stratified according to malaria transmission risk, an approach that has allowed us to deliver tailored packages of malaria intervention. This has enabled us to use our resources more efficiently and in a targeted way. Because of this approach, we actually expect to see a faster decline in the malaria burden, and we are hopeful that we will begin to see trends towards this expected decline in the current malaria indicator survey. Additionally, we know that the fight against diseases cannot be won by the health sector alone. We therefore came up with an innovative way of using digital data to drive action and accountability beyond the health sector. This has been achieved by engaging parliamentarians, regional commissioners, district commissioners, council executive directors, councillors, etc. We have trained parliamentarians and all necessary stakeholders on the use of the famous digital scorecard application, which our Honorable Minister for Health, Umi Mwalimu, launched in 2019 during the SADC Malaria Day, aimed at tracking the performance of indicators down to the community level. This innovative way of using digital scorecard has been shared in the Alma Scorecard Hub to showcase a best practice for other countries to learn. On that same note, we commend and acknowledge the great development of using innovative tools in the control of malaria vectors, specifically on the next generation nets, aiming at addressing mosquito resistance to insecticide. This is why Tanzania is currently working towards local manufacture of next generation nets, an idea that has been inspired by Her Excellency Samia Suluhu Hassan, the President of the United Republic of Tanzania. We are hopeful that the international manufacturer will, of course, be willing to transfer the requisite technology to our country. Well, to conclude all this, we are in alignment and we agree that new tools and innovations are very much needed, not only in our country, but globally to fast-track the progress towards achieving elimination of both malaria and neglected tropical diseases. Thank you.
Thank you so much. Thank you so much for that, Dr. Beatrice. As she reminds us that the last mile often becomes the most difficult. And we just heard about your best practices in terms of adopting these tools in the fight against malaria. So I want to turn to you, Dr. Juan Manuel, because I think we have an opportunity here. We've heard from Tanzania. There's an opportunity to also hear from Argentina. I know you're also early adopters of these innovations. So from your perspective, if you could share with us some of the innovation successes that you've had in your programs addressing neglected tropical diseases and malaria.
Good afternoon. First of all, I would like to thank the government of Rwanda for the invitation to participate at this summit. Despite the significant advance and commitment made in recent years, neglected tropical disease continue to be a global health problem. Therefore, it's necessary to continue concentrating all possible efforts in achieving a better response through new tools for prevention, diagnosis, and treatment, but also guaranteeing greater access, equity, and quality to them. Innovation is the way forward in this regard. A clear example being how we were able to develop a rapid response to COVID-19 pandemic using and adapting strategies that in some cases were designed to improve access, management, diagnosis, and treatment of entities. It's very important that we work to make access for tools for prevention, diagnosis, and treatment of entity simple and sustainable, using innovative approach to allow us to identify common problems, seeking solutions together. Our approach is to think of local solutions that can help provide global response. As an example is the case of a South cooperation experience, where countries such as Mozambique, Ethiopia, Kenya, Spain, and Argentina participate in the development of an innovative strategy for a more effective approach in the treatment of soil-transmitted helminth infection, for which a public-private partnership has been created between areas of health, science, technology, and academia to evaluate efficacy and safety of co-administration of albendazole and ivermectin for the joint treatment of 4 soil-transmitted helminth infection with a high burden of disease in these countries. In other words, we have common problems that mainly affect the development of children and affect more than 2.4 billion people in different areas around the world. But the strategy can also be effective in areas with high burden of other diseases such as lymphatic filariasis and scabies, has occurred in some sectors of African continent. Another example developed in our country that can be used in other countries has been the development of the pediatric formulation of benidazole for the treatment of Chagas disease in newborns. In Argentina, the vertical transmission of Trypanosoma cruzi is the main cause of new case, and its control is central to moving toward the elimination of this entity. This is treatment of simple administration for children, a great advance that can be used in different countries. It's important to mention that health decisions of government also play a central role in this advance, which is why on May 22, 2019, Argentina was officially recognized as a malaria-free country by the World Health Organization. In summary, in our experience, we believe that it's essential to opt for innovative approach in development of diagnostic tool and treatment of NTD that can be applied at the first level of care, expanding access, but also with a focus on greater efficiency of all means. Once again, the key is sample, identify common problems, seeking solutions together, making more efficient use of resources. Thank you.
Thank you so much, Dr. Juan Miguel. I want to capture that last part that you just said about, it's about working together and seeking solutions together. We have a few seconds to go. I want to do just a few key takeaways, right? Starting with you, Dr. Philip. What's your key takeaway from here that you want the audience to know? Just a few sentences.
Yeah, that in addition to the innovations, we need an equivalent focus on the launch, the rollout, scale, and access. Partners like the Global Fund and above all, the country leadership, such as the great examples we heard from Tanzania.
Dr. Bernard, what about you?
Innovation and access should go together. When we start an innovation, we need to have access in mind. When we define the characteristic of the product that we want to develop, we need to have access in mind. This is my main message.
Perfect. Thank you so much. What about you, Dr. Petrus?
Thank you so
much. So as we know, we are in the last mile, right? And as exciting as that sounds, the last mile can be challenging in terms of efforts needed, in terms of resources, in terms of time. And before we know it, it's 2030. And it's like finding a needle in a haystack. So as we're thinking of innovation in terms of tools and new tools, let us also think of innovative ways in which we can engage those who are beyond us, who are already avid believers in this end malaria game.
Thank you so much. Dr. Juan Miguel, last but not least.
Health problems have no limited borders. We must contemplate their responsibility to share the knowledge, considering any local development can have a global impact.
I want you to help me thank our speakers today. We've heard from multiple perspectives, the Bill and Melinda Gates Foundation, the DNDi, and from Tanzania and Argentina. Thank you so much.
Thank you to Noella and our panelists. Hopefully, we will be having even more exciting commitments coming up in the discussions to come, and of course, more insights. Joining us on stage now to further engage in discussions on focusing our attention towards opportunities of improving timely and effective access to new tools and technologies by those in need. Please help me to welcome Mr. Maha Barakat. Would you like to use the, there we go.
Thank you very much.
Please have a seat. Thank you. So, Your Excellencies, ladies and gentlemen, good afternoon. Jambo. Please join me in welcoming our panel for this session. And we're very pleased to welcome the Honorable Senator Mutahi Kagwe, Cabinet Secretary of Health from the Republic of Kenya. Dr. Maraika Winrocks, Chief of Staff, Global Fund to Fight AIDS, TB, and Malaria. We have Dr. Lutz Hegemann, who's the President of Global Health and Sustainability of Novartis, and Dr. Mark Sullivan, Managing Director of Medicines Development for Global Health. So this second part of the session for innovation will address access. How do you improve access to innovation? And we'll focus on opportunities to improve timely and effective access to new tools and technologies by those in need. This will explore lessons from current experience and opportunities to build on existing efforts, including issues relating to production and supply, regulatory approval, market shaping, financing, and demand creation. Given the breadth of the topic and the significant depth of panel experience and limited time, we will concentrate on two areas when it comes to access to innovation. Firstly, the current landscape, exploring some of the key issues and drivers impacting innovation to access. And secondly, what does the future look like? What opportunities does our panel see to unlock the potential to improve access to innovation, new tools and technologies in the future? So for the current landscape, if I may, I would like to ask Dr. Hegemann my first question, which is, how can we incentivize and enable R&D into these kinds of new tools and technologies, particularly for the so-called diseases of poverty?
Yeah, thank you very much, Professor Maha. Ladies and gentlemen, let me start by expressing my pleasure to join you here at the Kigali Summit on Malaria and NTD, which we believe is a critical moment to highlight the cross-sector support that is needed to advance our journey to control, eliminate, and eradicate NTDs. When I think about access, then to me it needs to be a key focus area of the private sector, and it is intrinsically linked to the innovation that addresses unmet medical needs. And here, I believe we have the moral obligation as the private sector to look about access in a true global sense, and not necessarily sequential by countries, but to make our innovation accessible to as many patients as possible. And the other element that to me is also a moral and ethical imperative is to not be too selective about the diseases that we research and develop, and that of course includes malaria and the neglected tropical diseases. And I believe that this intrinsic motivation you will find in a lot of organizations to drive R&D where it truly matters. At Novartis, for instance, we have a dedicated Institute for Tropical Diseases with about 150 researchers that dedicate all their efforts to the discovery for malaria and neglected tropical diseases. So I think the research part is reasonably well covered. And then, of course, we have certain incentives like priority review vouchers. We have hopefully continued respect for intellectual property. And we also do have PDPs, product development partnerships, which help offset the R&D burden. But then the critical element lies into translating the innovation to access. And here what we are looking for is a predictability, because the R&D investments typically precede access by 5 to 10 years, but also a sustainability of the model and the speed by which we can get innovation to the patients who need them the most. And as we heard in the previous panel, I think we need to look at that entire continuum from R&D to access to impact, and that is ultimately what motivates us to work in this space.
Thank you very much, Dr. Hagemann. And that might take us to our next question, if I may ask Mr. Sullivan. What are some of the challenges and opportunities that you see in being able to bring these to market as efficiently and effectively as possible?
Thanks for the opportunity to be here. It's wonderful to see everyone here. I think some of the challenges are pretty self-evident and won't be a surprise to anyone in the audience. So number one will be money. And our ability to access the funds to do the R&D work. Our industry is essentially built on massive expenditure in R&D, followed by revenue generation once the drug is approved and on the marketplace. And of course, that doesn't exist in our field. The expenditure still there, still the same level, and something that we have to support and acknowledge the wonderful contribution of the field, the industry partners, the PDPs, and perhaps a novel group like us to come in and work in this particular area to go through that. But the financial aspect is something we have to manage and manage carefully. That expenditure is still there, we have bills to pay, and we have to cover them. So managing the money is number one. I think the second area is the regulatory and guideline framework that we have to negotiate. I think that in the past, that process has been a little bit adversarial. That the regulators see industry as someone that they have to be cautious about and careful of, and I also think the same applies for some of the interactions with the WHO. I think that's getting better. And rather than seeing us as a partner, somebody or an organization who are trying to bring forward new medicines and to work with the field to do that, not for our benefit, but for everybody's benefit, for the community's benefit. So I think changing that mindset will be helpful, and that maybe heads us towards the opportunity area, which is to try and bring that better integration into the regulatory framework of review of the dossier, which must be robust, and it's important that it meets all of the standards that you would expect of any medicine. But that perhaps some of the policy and guideline aspect comes, instead of being sequential, comes to be more parallel, so that there is a better integration of R&D and the data that we're generating in R&D, which costs a fortune, for the ultimate use of a medicine. That's one of the problems in our field in pharmaceutical medicine. Developing a drug generates a certain set of data to get a regulatory approval. It doesn't answer all the questions that we need to answer, such as use in children or use in pregnancy. We can't always answer those questions in the development pathway. But I think we need to come together to try to find ways to address what data the public health community needs and help work with us to bring that forward so that we get our medicines faster.
Thank you very much. And of course, by understanding the challenges, it gives us the opportunity to be able to move forward and resolve And if I may turn now to my colleagues on the right, I'd like to ask this question to both the Honourable Senator and to Dr. Windrox. And the question is, what are some of the ways you are supporting innovation in access to current and new interventions needed to tackle malaria and neglected tropical diseases? And if I may, I'll ask Senator Kagwe to start. Thank you.
Thank you. Thank you very much indeed. First, let me take this opportunity to thank the organizers of this event, and indeed thank the government and the people of Rwanda for the very warm welcome that we continue to receive from you every time we come for this meeting. Secondly, I think the topic of innovation and tools to use in malaria and NTDs is essentially the innovations that we are talking about must emerge from where the population needs them. In other words, tools and innovation must be responsive to the people who are using them. And they will not be very successful unless that is what they are responding to. Tools and innovation for the sake of itself, in itself as an end in itself, does not render a lot of usefulness to the society. And because of this is why for us in Kenya, the first thing that we are focused on is the issue of surveillance and data to guide us in the decision-making and the application of whatever tools and innovation is available to us. That's why, for example, we launched the malaria scorecard, which we have used very effectively, both to monitor what is happening in the national government, but also in the subnational governments, to find out what decisions that we can make based on real data as discovered from the surveillance that we have done. I think the second very, very important tool that we have realized is the use and purposeful work with communities. And we were the first people to create the Malaria Army, Youth Army, which is here with us today. Thank you. And what we have found out is that by using the youth, by using the communities, then we get everybody involved so that the treatment and prevention and eventual cure of malaria is not just one that is focused on government action. It is something that belongs to the community. It is the people who get sick. It follows without saying then, it is the people who should be responsible for ensuring no sickness and eradication of some of these challenges that we are facing. I think that the other innovation is about the technical aspects of innovation. President Kenyatta launched the use of drones in Kenya, to fight larvae in areas where we cannot go to. And this technology is going to be very, very useful. We were here in Rwanda. Sometime we are doing the same thing, launching the use of drones. So technology that is responsive to the needs of the geographical environment in which we live is going to be useful, not just for photography and data collection, but also, to spray the larvae that exist in those areas. So when we do that, and when we use new technologies, and when we use even new medicines that are being discovered around the world, for example, Kenya is about to launch, the use of praziquantel or quantal medicines in terms of prevention of schistosomiasis and also for other NTDs that currently exist around the country. So for us, it's a question of practical things, 1, 2, 3, 4, go, 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 rather than a lot of theories that eventually will not result to a lot of results. I think for beginners, that's my gut feeling.
So thank you for sharing these very relevant examples of how to address some of the challenges. And if I may now turn to Dr. Windrox also to address the same question. Thank you.
Thank you, Maha. To start with, innovation is a must. The parasites and mosquitoes are changing all the time, so we have to move faster. And at the global we're working with partners all the time on innovations and prioritizing those that have most impact. And those can be at different levels. It can be on innovative financing, on accelerating the introduction of new tools and interventions, and on innovative ways to implement programs, including build the capacity of communities. A couple of concrete examples of the last couple of years: the seasonal malaria chemo prevention, which was also mentioned by the Minister of Health Nigeria this morning. We've scaled up massively from 2.7 million children in 2014 who were protected in the Sahel to 39 million last year, so it has been a huge impact on morbidity and mortality in children. The introduction of new nets, last I could pilot for it DBO nets, especially in areas with emerging resistance. And we've subsidized the introduction of the next generation nets, basically to build the evidence base and prepare for scaling up in the next cycle. And together with UNITAID, WHO, and Gavi, we've supported the RTSS, the malaria vaccine. For the next cycle, we are really looking at innovations and how we can accelerate the uptake of innovations. The malaria pipeline is more exciting than ever before, finally. So we really have to work together to provide access to new tools. And I also would like to mention a couple of potential innovations in the way we implement programs. Digitalization of campaigns, absolutely coming up, and our host country, Rwanda, is a real leader in digital health. Look at additional delivery point for BedNet, for example, schools. Very exciting, working with manufacturers and partners to look how we can improve the durability of nets and minimize the waste, because we have to care about the environment too. And then we have to look, we developed together with partners the malaria matchbox that really identifies the most vulnerable groups. And I think that those most of the people have been working with malaria matchbox. And I think it's really working with communities and civil society to reach those people that are most hardest to reach, most vulnerable. If there's one thing we've learned from COVID, it's that communities are absolutely essential. Thank you.
Thank you, Dr. Wynne. As always, I think the global health community is enormously grateful to the Global Fund, and as you said, it's the single most important contributor to funding in malaria for each 3-year cycle, so that's a tremendous support. So we've talked about the challenges that we have today, and I think what we'd like to ask the panel now is what do they see as the future in improving access to innovation? If I may go back to you, Honourable Senator, how can we work together to respond to local needs in developing and ensuring access to new tools and technologies for the future fight to end these terrible diseases?
Thank you. Once again, I think a number of things come to mind, because the issue of innovation, as I had said earlier, is one that is responsive to what is happening around the country. For us, I would like us to start with the issue of research. I think we spoke about the issue of research and the difficulties and costs that goes into research. But I think that to a large extent, most of our countries have been recipients of the result of research rather than themselves be part and parcel of that research. And therefore, it is important for us to do research comprehensively, working from here in Europe and other parts of the world. Because we don't know, when we don't do wide enough research and we don't base the research on very many other geographical areas, sometimes we are short of the knowledge of whether what is working in one area is actually working in another area, given the geographical, weather, and all other conditions that are different. And this is not just for this particular NTD area. It's across the board, even in cancers and other diseases. But I think so the idea of us spending more in research in our own countries, here in Africa and elsewhere, is important. For example, one of the recent successes is the Kenya Medical Research Institute that has discovered a new malaria rapid diagnostic kit, which is now in use in Kenya. Now, this means that whether there is COVID or no COVID, whether there are challenges of the supply chain, we will be able to get these kits as soon as possible, time possible. And this has been a challenge in the past. So for us, that is important. The second thing is the support of the local manufacturing capacity within the continent and within Africa. I think this is so important right now. And we are asking our partners, whether it's Global Fund or other partners that we have, that moving into the future, we do need to focus. We do need to encourage local production of all these materials. And for instance, in our country, one of the companies that is based in Nairobi, Universal, has now got World Health Organization approval for pharmaceutical products for use by pregnant women who contract malaria. This is a very important innovation, and it is important not just for Kenya, but for the rest of the continent that we live in, and indeed for the rest of the world. But I think that the other important thing is to gain political will. We have got to establish political will in dealing with these issues. That is why, for example, President Kenyatta, as chairman of ALMA, has gone ahead and formed the Malaria Council in our country, which is going to form the basis on which we can create the partnership between the private sector and the public sector on the one hand, but also ensure that the political community is also engaged. And we are pleased, for example, and we want to push for the first ladies in each of our countries to become champions of malaria so that it is a center. Malaria and NTDs become center so that we do not have neglected diseases, because neglected diseases essentially means neglected people. You know, and what we don't want to do is to create that situation. So we have got to come back and centralize the discussions so that it is part and parcel of everyday discussions. I think financing of these issues is again a challenge in the future. And the question is, how are we going to do this? And I think it's going to take the private sector, the corporations in terms of social corporate responsibility, working with partners such as Global Fund, the Clinton Foundation, and other foundations that we have been working with. We will need them to continue working with us. But I think we also, on our part, have to put our money where our mouth is and have greater allocations of funds to NTDs. I think I'll stop there.
Thank you. I hope that was your Minister of Finance in the audience. So
you know, before I just leave that one, the final one that I really want to talk about is the Global Fund and replenishment effort that is currently going on. I think that it is in our enlightened self-interest as a global community to ensure that the effort by the Global Fund to replenish and grow the funds that they have got to use for use in this area is actually done. And Kenya is leading from front by increasing the amount of money we are allocating. No, even though we are not a rich nation, but the little we have, we are prepared to share. Yeah, thank you.
thank you. That's tremendous, and what a role model for other countries in the continent and outside. So thank you for that. If we may turn back to Dr. Hagemann now. So the question for the future is, the pharmaceutical industry has been instrumental in helping drive innovation in the fight against malaria and neglected tropical diseases. What does the future hold for you?
Yeah, I think if we reflect what has happened since the London Declaration in 2012, then the private sector collectively donated 14 billion of treatments against neglected tropical diseases. And in 2019, that's where we have the latest number, the sector donated collectively 1.8 billion, which was twice the amount that was donated in 2011. But I firmly believe, and it speaks to the notion of innovation, as the Honourable Senator mentioned earlier, that we have to go beyond a donation model, and we need to make sure that companies bring their full organizational capabilities behind the cause of malaria and neglected tropical diseases. And with that in mind, on behalf of Novartis, I'm very pleased to endorse the Kigali Declaration with a financial commitment of $100 million to advance research and development in our neglected tropical disease programs over the next 5 years. And in addition, because we also deeply care about malaria, we'll invest another $150 million into R&D, into research and development for new antimalarials, next generation, to combat emerging resistance to artemisinin, and a new formulation for small babies to address the particular burden of disease in children. So collectively, with this combined summit now, we are putting $250 million behind the cause.
Dr. Hagemann, that's tremendous, and we are very grateful to Novartis for this. Thank you. And then, penultimate question to Dr. Winrocks. What next for the Global Fund? You have a new strategy and are hoping to mobilize significant new resources this year. What will that mean, particularly for malaria? Thank you.
That will mean a lot for malaria. I don't have to tell you that malaria is off track. And it's partly because of the impact of COVID, but there are also underlying root causes like climate change, drug and insecticide resistance, lack of funding, lack of political commitment in some countries that really have caused malaria going off track. So business as usual is not an option. And we know for malaria, if we take our foot off the pedal, it will come back with a vengeance. So that's why we, in our investment case, we ask for $18 billion for the next 3 years for the Global Fund. And I see there's the advocate sitting there. So the replenishment will be hosted by the United States in September, and President Biden has already committed $6 billion. But there's a snag. According to US law, The US can only contribute up to 1/3 of global fund. So it means that the full $6 billion will only be realized if we can mobilize $12 billion from other donors. It also means that every dollar from other sources will release 50 cents from the United States, and vice versa. Every dollar below the 12 billion will lose also 50 cents from the United States. So we really need a full replenishment, a full 18 billion. And if we get to the 18 billion, what it would mean for malaria is that we can cut malaria deaths by 62%, that we can reduce the number of cases by 66%, and that we can eliminate malaria from 6 more countries in 2026. So if that's not a good sales pitch, I don't know what is. There's also, so malaria will focus very strongly on reducing the number of new infections, have a stronger focus than ever on resilient and sustainable systems for health, with a greater focus on community and community health workforce, and on integration, a topic that was discussed in the panel this morning. Also, under a full replenishment scenario, we do have significant funding available, so-called catalytic funding, which will complement country allocations, and with a very strong component on innovation for malaria, with funding to address biological threats to case management in Africa. And we know that resistance is a real risk for Africa. For funding to further roll out the next generation of bed nets and do market shaping so that these become available and affordable over time. And also vector control threats and opportunities, where we see there's lots of new products in the pipeline. But none of this will happen if we don't have a fully funded global fund. So we need all of your support. Fight for what counts. Thank you.
That's tremendous. Thank you. Thank you. So if the support of the audience is reflective of the global support, we're very hopeful you will achieve that target. Thank you, Dr. Winrocks. And then our final question to Mr. Sullivan. What are you excited about for the future in terms of access to innovation?
I'm excited by lunch, so I'm sure you all are as well. So I'll try not to stand in the way of you getting to lunch, but I think that we have really a wonderful opportunity to innovate in this field. And I think that the integration that you've heard with the previous panel, such as Bernard from DNDi mentioning, as well as this group talking about the integration of the entire process. You know, I'm a pharmaceutical developer. I work to develop new medicines. That's my career, my life work. I'm very proud of what I've done. It's not enough. It's insufficient to think about things in terms of I get a regulatory approval and then my work is done. Of course, we have to integrate all of these aspects and the partnerships that are needed to bring our medicines and our innovation through to the people who need these medicines, innovations and diagnostics are the real critical things. I'm really excited by that opportunity. I love working in this field because the field plays really well together. We're not working against each other. We work with each other. We share our data. We share our information. It's a really rewarding and lovely place to work in. And I think, you know, again, some of the innovation, the company that I run, Medicines Development for Global Health, is a non-profit pharmaceutical company. And he thought those two terms could not ever sit together. They can. We've been going since 2005. We now have medicine approved, another medicine in development, and we have bigger ambitions and bigger plans. That's very exciting to bring the mechanism of developing new medicines and hopefully working towards delivery of those through a non-profit structure, and the PDPs have been our role model in this, is a very exciting thing. So I am very excited by the future.
And lunch. So that's tremendous. And we are very grateful that the different models are being implemented to maximize the benefit globally. So it's not just for the for-profit entities that are working on this. We have many not-for-profit as well, and obviously their work is successful. So to conclude in this panel, I'd like to thank them, all our speakers, for giving us hope that critically needed innovation in the fight against malaria and neglected tropical diseases will be made available to those most in need, and hopefully in a more timely and effective manner. We heard this morning from Dr. Corinne Karema that by the time this summit finishes, 480 children will have died from malaria. The clock is ticking. And, you know, there isn't any time to waste. So thank you all for your commitments. Thank you for keeping the momentum and the motivation going for meeting the difficult targets despite all challenges. And with that, I think we conclude this panel, and hopefully you will have a wonderful lunch. So thank you very much, everybody. Thank you.
Thank you, Dr. Barakat, and of course our panelists. And lunch is coming up soon, but first we do have some exciting items to get through. So thank you once again to our panelists for that discussion. We did get a big reaction to one of our panelists saying that we must put our money where our mouth is and have better allocation of funds. And I do feel that that is a beautiful segue into the next part of our program. As I mentioned at the start of today's program, this summit is a historic moment for leaders to renew their commitments set at the 2018 CHOGM, endorse the Kigali Declaration, and mobilize a fully resourced global fund replenishment later this year. Investments in the fight against malaria and NTDs will strengthen health systems and support long-term sustainable pandemic preparedness. It is for this reason that I'm very happy to introduce the following individuals to you who are here today to make firm commitments on behalf of the organizations that they represent. So first off, yes, I think that's going to be something very exciting. So first off, please welcome the Managing Director at Bridges to Development, Dr. Julie Jacobson.
Hello, I'm Dr. Julie Jacobson, and I was privileged to be deeply involved with the London Declaration in 2012 and the birth of Uniting to Combat NTDs, and I'm delighted to be here today in Kigali for the Kigali Declaration and the next 10 years of progress that we're going to make. Today, as the managing partner of Bridges to Development, I would like to make an announcement about a new coalition that's coming together about a neglected aspect of a neglected tropical disease. Schistosomiasis is a disease that's contracted by contact with contaminated water. In sub-Saharan Africa, the parasite actually lives within the pelvis, and it affects the bladder and the genital tract. Women who are affected with this have symptoms that mirror sexually transmitted infections. They are at risk of infertility, ectopic pregnancy, and higher acquisition of HIV. This syndrome is very not looked at within the health system. And so to do and address and solve this problem, we don't need parasitologists. We need people who work in sexual and reproductive health. And so we would like to announce today the start of an integrated program or an integrated coalition called the FGS Integration Group, FIG. And through this, we have a co-led initiative by Frontline AIDS and ourselves at Bridges to Development with a very innovative group of partners that are dedicated throughout sexual and reproductive health, working in cervical cancer, working in HIV, and working in reproductive health services and WASH to come together to address this issue. Bridges is committed to continue on innovation and integration and partnership in this area through work in skin NTDs and other pieces, bringing new donors such as Takeda Pharmaceuticals in our work with the Ministry of Health in Vanuatu, who you saw here today, and Papua New Guinea. We remain in this fight and look forward to continuing the battle with you. Thank you.
Now let's welcome Senior Vice President and Chief Global Health Officer at GSK, Thomas Brewer.
Distinguished guests, colleagues, and ladies and gentlemen, at GSK we are guided by our purpose to unite science, technology, and talent to get ahead of disease together. We have a rich heritage of reaching the underserved at scale, supplying more than 10 billion tablets of albendazole, part of the largest drug donation in history, to drive the elimination of NTDs. We are reaffirming our commitment to supply albendazole until elimination and extending our commitment to cover a third disease of WHO's NTD roadmap, echinococcosis. We also developed the first malaria vaccine, which will be introduced in Gavi-funded countries from 2023, and the first radical cure of Vivax malaria, and are fully committed to ensuring access and contributing to reaching global malaria goals by 2030. To that end, and it's important, we are doubling production of the adjuvant needed to make the malaria vaccine to meet projected demands for the vaccine in the medium term. But we want to do more. The greatest contribution GSK can make is through our science. Today, GSK commits to invest £1 billion in R&D over the next 10 years to get ahead of infectious diseases, including including malaria and NTDs that disproportionately impact people in low and low-middle income countries. This $1 billion investment will be critical in accelerating the development of new medicines for malaria and NTDs, offering shorter, simpler, and safer treatments for patients and getting ahead of drug resistance with new vaccines. We make this commitment to the people that desperately need new medicines and vaccines to enable them to thrive. Thank you very much.
Wow, that's sure to make a huge difference. Coming up next from the Wellcome Trust, Diogo Martin.
Ladies and gentlemen, distinguished guests, it's a real honor to be here to share our commitment on behalf of the Wellcome Trust. As we gather in the Kigali Summit, it's really important to remember that snake bites is one of the most neglected of the neglected tropical diseases. Every year, there are millions of snake bites all around the globe, and over 100,000 people die from snake bites, and almost 500,000 survive with long-lasting disabilities. And this is why we at Wellcome are 100% committed with our £80 million program to transform the way snakebite treatments are researched, developed, and delivered. We hope to, until 2026, work with our partners worldwide in 3 different ways. First, to help modernizing the antivenom treatments are produced, obviously trying to make them as safe, as effective, as cheap as possible. The second way is to really seed the pipeline for the next generation of treatments. And last but not least, working with the countries to make sure these treatments are integrated into the health systems where they're needed the most. Obviously, outside our snakebite program, and obviously in line with our new strategy at Wellcome, we will continue to encourage and support NTD-related research through our various competitive funding mechanisms. But obviously, with our program, it will last until 2026. But what we want to see and what we want others to join is to join us in bringing more funding for snake bites and more funding for NTDs, because we believe this is the only way we can really sustain that bright future ahead if we all come together. Thank you very much.
Thank you. These are huge numbers and sure to make a big, big difference. And finally, Pfizer Chief Sustainability Officer and Senior VP of Global Health and Social Impact and President of the Pfizer Foundation, Caroline Rowan.
Thank you so much. It's an absolute privilege to be able to be together. And I want to start by thanking, of course, Uniting to Combat and RBM's Partnership to End Malaria, as well as Rwanda for hosting us today. I want to take a word about trachoma and Pfizer's commitment. For those of you that don't know, trachoma is the leading infectious cause of blindness, and it is both a cause and a consequence of poverty. Back in 1998, Pfizer and the Edna McConnell Clark Foundation created the International Trachoma Initiative. That was our effort to provide and scale access to an important antibiotic as part of the World Health Organization's SAFE strategy. Fast forward to today, Pfizer has donated almost 1 billion doses of an antibiotic called Zithromax. Yay, thank you. But more importantly, that's enabled the treatment of 270 million patients. And together with so many familiar faces in this room, with the research committee and with governments, we have eliminated the disease as a public health threat in 13 countries. As part of this progress, we know elimination globally is in sight, and I am so proud to announce Pfizer's extended commitment to the International Trachoma Initiative through the year 2030. This is one of many examples of our deep and abiding commitment to improve health for everyone, everywhere. Thank you so much.
Thank you. These are huge commitments. I don't know if everyone heard some of the numbers that were just mentioned, but this is going to make a big difference. I think we can give them another round of applause. Distinguished guests, ladies and gentlemen, we are about to take a break, so please note that you will need to be back to the venue at exactly 1:55 for the commencement of the next session. So thank you so much, and we're talking about Central African time for our people who are joining us online, but people in the room, 1:55 for you. Thank you so much, and we'll see you at lunch.